Hi, everybody, and welcome back to Dr. Cammy and Karen Go Keto / Carnivore. And here we are talking about our very new decision to for sure call this Dr. Cammy and Karen Go Carnivore because we're both on the way to carnivore transition. So, Cammy, take it away and let us know what's happening over on your side of the woods.
All right, thank you. Well, yesterday it was 75 and sunny on December 4th.
Felt like it was 12 degrees here.
That's what happened. That's what's happening in my neck of the woods. But yeah, so I kind of think you think this way that like carnivore is kind of a subset of a keto lifestyle, because you
Yes.
are watching your carbs. And so we are kind of doing that. I've been doing well. I don't have any cravings. And I think we're going to title this video "The Calm Before the Storm?" Because I am still eating some carbs. Like I was sharing with Karen before we started taping that I had some low carb bread yesterday, which was really 10 carbs per piece because there's 8 grams of fiber in it and they consider it 2 net carbs, but my body thinks of it as 10 carbs and that's how it processes it. But I had a good, I ate good food in between those meals. And I also am eating some processed food. I went and got at Costco this little trio of provolone cheese and salami and pepperoni. And it's delicious and it's easy because you can throw it in your purse in a baggie. And then when you're hungry, you just pull it out and eat it. But it's processed and it's full of nitrites. And so I'm going to try to figure out a way, like maybe just make some meat and then just slice the meat and some cheese and just throw it in your purse. That would probably be a much better solution, but doing really well. And the thing that's so interesting to me is that once I made the decision that I'm going to go carb and I was really kind of feeling
Wait, you just said you're going to go carb.
I'm sorry that I was going to go carnivore. Thank you, Karen. And that I was really feeling some relief about it, which has been really interesting over the last couple of days. I haven't had cravings for carbohydrates or for highly processed sugary foods. And the voices that go on in my head that try to keep that conversation going all the time are not there. And so I'm a little frightened because I'm thinking, is this the calm before the storm? Is it just sitting back and waiting for me to kind of start having, plant little thoughts here and there? Because that's what it's done in the past. But my mindset is totally different this time. I've been through the suffering of the carbohydrates and the binges and the processed foods. And I just pray to God that I'm finally done and really, you're ready when you're ready. You have to get sick and tired of being sick and tired. And that's where I just think I am right now. And I'm feeling really good. I have energy. I sleep well. I need to sleep. I don't need as much sleep and I'm not bloated. I'm not gassy. I'm not fatigued. I still have some like joint pains and things like that, but we'll see what happens with a little bit more time. So that's what's going on with me. Yay. What's happening with you, Karen?
Yay. Well, you've kind of mentioned most of the top quick results that people get from going carnivore. And maybe part of it, a lot of people mention, like in the first few days, no depression. If you go on Carrie's YouTube channel, Homestead How, he's got a great channel, and that's one of his big things, is the depression went away right away. And maybe that's some of the feeling that you're feeling, right? That you didn't phrase it that way, but that could be the feeling of relief that you're feeling. Maybe that's another way of calling it. And you talked about the cravings going away. Kelly Hogan talks about that all the time on her channel. And the bloating, I can tell you, when I go carnivore hardcore, I don't feel the bloating, but I've got that Diet Coke back in my diet. As you know, I said I was going to have one a day, and I feel my stomach feels miserable. I feel bloated. I feel heavy. And so I was going to drink that until December 30th. And now it's like, okay, I think I'll cut it back to one every other day and see how quickly I can actually get it out. I could just get it out tomorrow if I say so. But for this purpose of this experiment, we'll see how I feel after giving it up for, every other day or every 3 days or once a week or something. Because I think that that's what we're doing, right? This is the N=1 experience and experiment. And it's going to be interesting to see how it goes. It's been pretty easy, I think, so far. But one thing I will say, I want you to watch this video again because you talk as if you said you changed your mindset, but you talk about the voice in your head and you're wondering when it's going to come back, as though those are different things. That voice in your head is you. That mindset is you. So
I know, but I
I'm guessing that mindset, well, if your mind keeps it away, then it'll stay away. And if your mind doesn't keep it away, but I do think that there is a chemical. Clearly, everybody talks about that on the carnivore. So there is some sort of chemical, something that's gone on in your brain. But
right.
there's no point in living in the future to see what's going to happen when you can just live in the past and say what happened.
Or you can just be in the present, right? You want to just be in the present and deal with what's happening at this moment and the choices that you make. Because the other day I was in the car and I was like, I was going to go to Baskin and Robbins and get in a certain flavor of ice cream. And I decided I was going to have hot fudge on it. And then I was, okay, fine. I'm heading in that direction because I was going that way anyway. And that's a wonderful reason to stop because I'm heading in that direction, just crazy things like that. And then as I thought about it and I thought, that's really not what I'm up to right now. I'm up to like eating a carnivore diet, and Baskin and Robbins is not part of a carnivore diet.
Right.
And I thought, yeah, okay. So I didn't go. But it scares me. It frightens me because I've been in situations where I know better. Like logically, I know, but then I talk myself into going, and you're absolutely right. It is me. I am the same person, but sometimes I just make the wrong choices. And I feel like I hate to think of myself as being weak because when you have an addiction, it's like a disease. And like people that have high blood pressure don't think of themselves as weak, or a diabetic doesn't think of themselves as weak, although I guess their pancreas is kind of weak. But so I don't want to think of myself that way, but I just have to take one moment at a time, one meal at a time, and know that I can do this, that this can happen, that this can be a totally different way of living for me than I've ever lived before, long term, and for now in the present to just see how it goes.
Well, I would say that the examples of high blood pressure or diabetes, I would say people actually do feel weak. I think that there are diabetics that feel like they are very in a special precarious position. And if they don't eat properly or don't eat in a certain way, their health will suffer quickly deteriorate. And I think that people with high blood pressure have been told by their doctors that they should be worried about their heart and, their overall health, which I don't know if that would go under weak, but certainly would go under special, right? As that, it's not just normal. So, people don't have high blood pressure and are considered normal, or at least their blood pressure is
Yeah,
not considered normal. But if you ask somebody who's got low blood pressure, they often actually have physical weakness.
right. But I guess what I'm talking about is like morally weak because society looks at fat people as morally weak. Like, those people are mentally ill because they can't figure out how to eat right and be healthy, because they're obese and fat. And look at those people. I mean, I think the way that society looks at heavier people and obesity is different, although there's a much better understanding about it now. But I'm thinking about like morally.
Well,
And you're
mentally,
talking more physically.
yeah, and you just mentioned mentally. So I mean, there's a difference between morally and mentally. And mentally, look at Georgia Eads' book. She's talking about depression and the psychiatry. The low carb diet and or because I think she's actually carnivore, but low carb diet for sure, ketogenic diet for depression and other psychological disorders. And hey, by the way, that's another way of saying mental disorder. So maybe, I don't think that's too far to say that people have that sugar is causing mental issues.
I agree. And that makes me feel weak when I can't say no. That makes me feel like that makes me feel bad about myself. But that's me. That's my shame and my guilt and all of those things that have been with me for so long. And just being able to shed that now is really promising and hopeful for me.
Well, but what would you expect if if the society says the basis of your diet should be whole grains, and that if you actually had a diet that the basis of it was whole grains, it would make you mentally unfit, right? And make you unable to control your eating of carbohydrates, right? I mean, this is just the way society is set up to say, yeah, we want you to eat in a certain way, but for those people where they eat a certain way and they start gaining weight, well, gaining weight is not the only issue behind eating carbohydrates. It's going to take society probably another 10, 20 years to figure out or to actually embrace the whole carnivore or low carb movement. And there are actually a lot of people that are against it because they make too much money in what's obvious.
You're right, Karen. It's such
What better way to demonize you and say you can't control yourself? And it's like, no, I can't control myself. And it's just because society tells me eat this and I can't control myself.
right. And that's what I just did, trying to do these little portion controls, like have my protein, have my vegetable, have my fruit, or have my grain, or have this, that did not work for me. That did not work for me.
Yeah. Yeah. So at any rate, we're on our way. We'll check in.
And I also want to mention that I'm going to see Jeff today for my weigh-in and my check-in. I'm going to talk to him about maybe dropping my exercise a little bit less and not being so rigorous with trying to build muscle on my body. So I'll update you with that on the next video.
Yeah, because ask him maybe about cortisol and adrenaline, because those are both strains on your body that
Yeah,
may require more energy that, you might not be willing to give it right now.
right.
Yeah.
All right, everybody, take
All
care.
right. Bye, everybody. Thanks for watching.
Bye.
Subscribe, like, whatever, comment. Bye.
Bye.